And now, to officially start our program, I would like to introduce San Antonio Chamber of Commerce President and CEO, Richard Bettis.
Thank you, Belinda. And good afternoon, everyone. Thank you for joining us for this important biennial event presenting the economic impact of the healthcare and biosciences industry on San Antonio and our region. We have a fantastic program for you today, where we will share the latest data and discuss resilience with our special guests. You know, every 2 years, the Chamber produces a report on the economic impact the healthcare and biosciences industry has on the city. And we do this in order to quantify and promote the growth, opportunity, and prominence of these important sectors. This report, utilized in Austin, Washington, D.C., and with companies around the world, highlights the weight of this industry due largely to the great work of many of you listening today and joining us today. Before I begin, however, I would like to take a moment to thank our study sponsors. You know, there is not a single thing that the Chamber does but for the fantastic assistance, support, and help of our sponsors, and I'd like to take a moment to thank them today. Our Benefactor sponsors, and we have 2 of them, that's at the highest level to help us put our study together. Our 2 Benefactor sponsors are the San Antonio Medical Foundation and University Health System. I'd like to say thank you to our Benefactor sponsors. They are allowing us to do this, and we appreciate it very, very much. Additionally, we have other supporting sponsors. We have 4 of them, and they too have provided resources to help us put this study together. It helps pay for our researchers and the printing and all of the things that we need to be able to get this thing right. Our supporting sponsors are BioBridge Global, Biomed SA, Methodist Healthcare Ministries, and UT Health San Antonio. Thank you to our supporting sponsors. Your help and assistance has been immense, and we appreciate it. All right, in addition to the researchers you will hear from in a few minutes, I would like to thank the members of our subcommittee who worked to compile the study as you will see it today. The members of the subcommittee are Corbett Christie with Texas Biomed, Kimberly David with the Baylor College of Medicine, Mary DeLay with UT Health San Antonio, Heather Hansen with Biomed SA, Pam Leisner with the San Antonio Medical Foundation, Nicole Leonard with the San Antonio Military Health System, and of course, our 2020 chair of the Chamber's Healthcare and Biosciences Committee, TJ Mays. Thank you again for all your work, your focus, and all you've done to make today possible. It is making a difference, and you will, of course, see that. All of our participants will be able to see that in the report today. And now, ladies and gentlemen, I'd like to take a moment to introduce Adam Hamilton, our 2020 chair of the board of the San Antonio Chamber of Commerce. He is president and CEO of the Southwest Research Institute, one of the nation's largest independent providers of advanced scientific and applied technology solutions in the nation. Adam has been an extraordinary chair of the board and has gone above and beyond the call of duty in service to our organization. Adam, thank you from an appreciative Chamber CEO and his team. You've done fantastic work. You've been there for us, and we can't tell you how much we appreciate you. With that, Mr. Chairman, the floor is yours. Thank you.
Well, thank you, Richard, and good afternoon, everyone. The unique medical, bioscience, and engineering assets in our community allow us to provide world-class healthcare services to our citizens and have turned our city into a national leader for entrepreneurship, growth, and innovation in the life sciences area. San Antonio's innate collaborative and inclusive nature make it possible for the life sciences community to provide innovative solutions and, when necessary, pivot to address emerging issues. At Southwest Research Institute, practically all of our successes in the fields of healthcare and bioscience involve other San Antonio entities, such as UT Health San Antonio, UTSA, and Texas Biomedical Research Institute. We are blessed to have such a tremendous healthcare and bioscience community, and I look forward to learning more about the economic impact of this industry on our city. And now it is my pleasure to introduce Dr. Richard Butler and Dr. Mary Steffel to present the results of the latest economic study. For more than 2 decades, Drs. Butler and Steffel have helped us turn data into consumable information. Dr. Butler is Professor of Economics Emeritus and founding interim dean of the School of Business at Trinity University, where he now serves as Alumni Engagement Coordinator. He has been at Trinity since 1982. He has served as a policy advisor to several mayors of San Antonio. He was also the founding CEO of the Alamo Academies, San Antonio's award-winning workforce development program. Dr. Mary Steffel is now President Emeritus of Healthcare Administration at Trinity University. She is a former department chair and former dean of the Division of Behavioral and Administrative Studies. She now spends some time with Trinity's development office, engaging alumni of the healthcare program, and serves on the boards of local nonprofit organizations, including Project Quest, the Master Leadership Program, and the San Antonio Humane Society. Doctors, we are looking forward to your report today. Thank you.
Let's try that again. Thank you, Adam. It's a pleasure to be with everybody today. I thought I had unmuted myself. As is usual, Mary and I will do this as a tag team. I will begin by talking about the big picture, and then Mary will delve into some of the key components of our industry so you can get the full picture. Next slide, please. We always lead with the bottom line. And so the big news is, drum roll, economic impact in 2019 of $42.4 billion. That's fairly awesome. The industry paid $10.4 billion to almost 190,000 employees. Those employees make up nearly 20% of the entire San Antonio workforce. And over the past decade, the industry has added nearly 50,000 net new jobs. Next slide, please. So where do we get these numbers? Well, two major sources of data. One from the Texas Workforce Commission quarterly employment and compensation review, which gives data for just about everybody with employees in categories classified by the federal government. And in recent years, we've also added additional data that's not from the Workforce Commission, from UT Health San Antonio, Baylor College of Medicine, and the military medical operations here. Next slide, please. So why do we do that? Well, this is the 18th iteration of this study. We began in 1996, and in 96 through 2007, we did a more constrained, conservative version of the study based solely on the public data at the Workforce Commission, no multiplier effects, and learned that there were some important things missing from the way that data was collected. So starting in 2009, we added to that data for the components that were missing from the public data, especially from UT Health San Antonio, Baylor College of Medicine, and our very large military medical operation. And we were also able to get some expert opinion from the industry about how much we export in various sectors of the industry. So we were able to apply multipliers judiciously for the first time. Next slide. A quick look at the time pattern here. You can see the overall economic impact has shown steady, robust growth over a 25-year period. Just for some perspective, the impact of the industry is up 74% since 2009, and it's about 4.5 times the size that it was in 1994. Next slide. An industry that big employs an awful lot of people. As I said before, it's about 18% of the San Antonio workforce. This is more than double the employment in the industry in 1994. And there are about 47,000 net new jobs since 2009. That's about a 33% increase. Next slide. Aren't numbers fascinating? Okay, these people are well paid. The total payroll that is paid to people who work in the industry here in San Antonio exceeds $10 billion. That's up 60% since 2009. Next slide, please. Yes. And the average salaries are very good. The average employee in healthcare and bioscience makes 7% more than the average employee in San Antonio. And note, these are just direct wages, does not include benefits. Next slide. The industry is composed of two major sectors. One are those who provide direct health services and those who support the provision of health services through research and many other things. And now Mary will explain that in a little more detail.
Okay, I think I'm a go here, right?
Yeah, you sound good.
All right, sounds good. This is always a pleasure to do this. It's a little unique this year, but we're really impressed by the way the Chamber has made this happen so efficiently. As Rich said, we're able to categorize the various forms of this industry, the various entities, into both the provision of direct health services as well as related industries. Next slide, please. This is what comprises health services, physicians, hospitals, other healthcare providers, which include all kinds of providers like dentists and chiropractors and podiatrists, mental health professionals. This incorporates both inpatient and outpatient services, nursing care, home health, and laboratories. Next slide. Okay. Related industries, as Rich noted, are those entities that support and provide backup for the provision of health services. The insurance industry, medical equipment, both wholesale and manufacturing, pharmaceuticals, social services, research, and education. We should note that research and education is a category we've been able to get a better handle on with the addition of military data and UT Health information. Next slide. Right, this is the overall pie chart, what the whole industry looks like. You can see there are two pieces to it. The larger piece is the provision of healthcare services, almost 2/3 of the economic impact. Hospitals make up the biggest percentage. That parallels what goes on nationally. And other services and physicians also have key roles. Next slide. This looks at the economic impact of the sectors over time, both health services in the dark blue and related industries. And if you just look at the slope of those lines, you can see that health services is increasing much faster than related industries. They've doubled since over the past decade, where related industries have increased about 40%. This is reinforcing the national concern about rising healthcare costs, which now comprise, as most of you know, 18% of GDP. Okay, next slide. All right, back to health services, just to take a closer look at that industry. And I think at this point I'd be remiss if I didn't give a shout out to STRAC, South Texas Regional Advisory Commission. This is the emergency coordinator, emergency healthcare and disaster coordinator for 22 county area in this part of Texas. And they have played a pivotal role in our response, the area's response to COVID, by networking with hospital administrators, county officials, EMS providers to manage hospital surge, share equipment, personal protective equipment, as well as ventilators. And they've done a remarkable job. Next slide. Here's how the pieces of this component fall out. No surprise, hospitals are the big bulk of the cost. Again, that parallels what's going on nationally. Physicians come in there at a significant role as well. Other services, I should note, include ambulatory care, and a sector which probably will be growing more rapidly in the future than it has in the past. Next slide. We always want to track the growth of hospital care versus physician care. As you can see, both of them have had, robust growth over the past decade. The hospital sector perhaps a little bit more than physicians, but both are healthy growth over time. Next slide. Okay, back to related industries. And I think it's important to note the important role that military medicine has in the San Antonio community. And this individual really reinforces that. Next slide. This looks at how the various components of the related industry sector fall out. It's interesting, social services this time comes out the highest level, the highest economic impact, followed only slightly by the pharmaceutical sector. It's been interesting to track these over time. Education research has decreased a little bit from our previous study, but that's partly because things have been moved around in the military sector so that it doesn't come out in the same categories. But still, it's interesting these are all important components of the related services industry. Next slide. Okay, summing up, to start to go back to where Rich started about the importance of this industry to the San Antonio community. It is a leading industry. It has a significant economic impact. Nearly 1 in 5 members of the workforce are part of healthcare and bioscience. It's innovative, it's been resilient, it shows regular and sustained growth. Next slide. And just to reiterate what our president and CEO said earlier, that we thank you to the sponsors of this study. And at this point, we'll entertain any questions.
Well, thank you very much. That was a great presentation, very interesting, and it's very encouraging to see the growth in our industry. We are a little short on time, but I think we have time for one question. That question is, given that the study is based on 2019 data, what impact do you believe the COVID-19 pandemic will have on industry data for this year, 2020, and the next?
Well, it's a good question. I'll start and then let Rich fill in. What's happening with the provision of direct health services is that hospitals are, while they're seeing a lot of COVID patients, they have the number of elective surgeries has declined, and many of them have moved to the outpatient setting. So you'll see, I think, a shift in the economic impact there, perhaps a little bit less for hospitals for the immediate future and more on the ambulatory care side. The other thing that's happening dramatically is virtual visits. Since the government has enacted full payment parity for virtual visits versus in-person visits. So a lot of that has shifted, and I think that will be continued in the future, especially for chronic care conditions. Rich, do you have any?
I'd add one thing to that, and that I think the COVID episode has showed that San Antonio is a place where we play well with other children in the vaccine area. And I think that will open opportunities for us in the future, that we have demonstrated we can be resilient, turn on a dime, and do wonderful things. So I think that's a positive indicator for the future out of many things we'd rather not call positive about COVID.
Absolutely.
Well, very good. Thank you, Dr. Butler and Dr. Steffel. Your input is always greatly appreciated. It's good to have you here with us today.
Thank you.
Thanks for the great report again.
Thanks.
Now, I have the privilege of introducing our keynote speaker, Dr. John Zerwas. Dr. Zerwas serves as the Executive Vice Chancellor for Health Affairs of the UT system. However, before I introduce Dr. Zerwas, I would like to take a moment to thank my friend, Dr. Bill Henrich, President of UT Health San Antonio, for arranging this privilege for us of having Dr. Zerwas today. So thank you, Bill. Dr. Henrich is an outstanding physician, an incredibly gifted visionary, and a tremendous asset to our bioscience and healthcare community. We always appreciate your support as well, Dr. Henrich. Now, back to Dr. Zerwas. Before joining the UT system, Dr. Zerwas held a distinguished career as a well-respected elected official representing Texas House District 28 for 7 legislative terms. He served on the House Appropriations Committee for 11 years, 3 as chairman, and 6 as chairman of the Appropriations Subcommittee on Health and Human Services. Dr. Zerwas was a physician for more than 30 years, receiving accolades in the medical field, just as he did while serving in the Texas House. In 2020, Governor Abbott appointed Dr. Zerwas to the Supply Chain Strike Force to assist with hospital and healthcare preparedness relating to the COVID-19 pandemic. He also serves on the Governor's Strike Force to Open Texas. Dr. Zerwas, thank you for joining us today.
Well, thank you, Adam. And let me just say straight up, ditto on all those comments regarding my good friend and colleague, Dr. Henrich. He is truly a gem for the San Antonio area, for the Health Science Center in San Antonio, and truly for the health of Texas, as UT has such a strong presence in the healthcare sector out there. But thank you again for having me. I always enjoy interacting with the Chamber of Commerce as an elected official, and certainly in settings like this. I think if you have your hand on the pulse of the Chamber of Commerce, you know very well what's going on in your community. And I'd also like to just send a shout out, as Mary did, to STRAC, as they have been incredibly helpful, not just to the greater San Antonio area and the trauma service area that they are responsible for, but truly to the whole state of Texas. They're kind of our go-to rack, if you will, when we need certain things accomplished. And so I share that same shout out and appreciation to them. You know, the theme of your this year for your chamber has been resiliency, as I've read it, and it's a topic that I greatly enjoy speaking on, and I'll sort of go back a little bit as to how I sort of got onto this topic. But as far back as 1990, which is hard to believe, 30 years ago now, that I was asked to make a speech on something, and I was doing some research on it, and I looked back on an essay that was written in U.S. News and World Report, and it was an essay about things that had changed over the previous 60 years, and what were all those things, and how many things had happened during that time. The author was William Manchester. He was involved with the John Kennedy administration, and it was very interesting to just go through all the different industry changes that had occurred over those 6 decades. But the quote that he finished off that essay with, which speaks exactly to what your theme is this year regarding resiliency, goes a little bit like this. I'll paraphrase it somewhat. But and again, remember, he's writing this back in 1990. But he said, if the man or woman of the 21st century expects to succeed amid the accelerations of the next century, he or she is going to have to be supple and malleable to change, cloaked in resilience and not self-righteousness. And so that to me really was so prophetic in terms of we look backwards and then looking forward, the 30 years after that period of time and where we are today, in fact. And if we look at resilience as that ability to bend and to accommodate change and the whirlwinds of the things that happen around us, but yet not break, are a great example of, truly extraordinary corporations, or whether they be corporations or whether they be, state governments like we enjoy here in Texas and stuff, and even in the local areas such as the San Antonio area. But I always sort of, think back on that when somebody mentions resiliency to me, because, that ability to, and I also appreciate the comment that Mr. Manchester made when he said the accelerations of the next century. And I don't know that any of us would disagree that the pace of change has been extraordinary in technology, certainly, but in any number of other places, and that unless we have the ability to change quickly, which was also mentioned, we are going to be left behind. And I think the point was made is, and especially appropriate for me as a politician to take this lesson, don't be cloaked in self-righteousness, cloak yourself in resiliency. And I think that's a very, very good lesson for all of us to take. And certainly, I had to be reminded of it periodically in the legislature and stuff. So as Adam mentioned, I've had the privilege to serve not only in this role at the University of Texas Health Science, the system in terms of their Executive Vice Chancellor for Health Affairs. I also got tapped by the governor, to help in the pandemic response. And initially, that effort was really a very strong effort to really reestablish our supply chain. As we all know, we're looking across the globe. We saw some pretty horrific things happening in Italy and other countries. We were witnessing New York and some of the, really overwhelming COVID conditions that they had up there. And we were kind of sitting back here in, the southern tier of states and in Texas included and saying, well, maybe we've dodged this bullet. But the governor had us come together. We knew that, personal protective equipment was in strong demand. But yet the supply chains had been severely compromised. And so, one of our first efforts working with others from Dell Technologies was to let's reestablish these supply chains. That was no easy task because, as you might be aware, when all of a sudden you need things like face masks, gloves, and gowns and other things, masks, everybody has a friend in China who can give you an infinite amount of that stuff. All you got to do is give them a $5 million check and it'll happen. Well, we chased a lot of those down. We never gave anybody a $5 million check, but we chased a lot of those rabbit holes down and, didn't find anything in most of them. You had to chase them down because, who knows, maybe there was something there that would have been, the answer to our issues and stuff. But nevertheless, we were able to reestablish the supply chains. The federal government stepped in with their air bridge effort, and we started getting PPE forwarded to everybody in a more reasonable way towards the end of April and going into May. Part of my role was to assess the healthcare capacity, which we clearly had that strained in San Antonio in previous months. And so, but my role, during March and April was to really assess what could we do if we could bring staff and we could bring the equipment that was necessary. How much could we actually do within the four walls of our hospitals? And I was very impressed with the amount of capability that our healthcare systems had just looking at them on paper. Now, that obviously got tested, and in the surge of July, we saw an extraordinary impact on our healthcare system. But we also saw everybody step up, and they stepped up in a way that I think all of us should be incredibly proud of. Certainly in the San Antonio area, I think most would agree they were on the brink of being overwhelmed to the extent that they reestablished an arena hospital, some overflow capabilities. Fortunately, for the most part, none of that was necessary. But you can't just stand those up overnight, and you got to be prepared when, in fact, you might need some of that. We witnessed that during July. We stepped up. Fortunately, the citizens of Texas stepped up with a very, very strong compliance with masking and distancing and all the things that we started off with that was shared with us at the kickoff of this meeting. And we're actually at a place where we need to reinvigorate that, in fact. But we were able to, weather that storm. Probably if you look at the place that had the greatest impact and really saw their healthcare system getting overwhelmed was down in the valley. Hidalgo County, Cameron County, we saw a great deal of strain down there. But once again, we flexed manpower into the area. The military was helpful in bringing additional manpower and expertise into the area. And they weathered that storm. And not one patient was denied intensive care services. Not one patient was denied ventilators if they needed ventilators. Basically, we stepped up and provided the care. And again, I think a lot of that was being supple and malleable to change. And again, not cloaked in any kind of self-righteousness, but trying to be resilient to the circumstances that had impacted us and stuff. And so we weathered that well. We're in the midst of another surge in the northern part of the state now. El Paso has had an extraordinary impact, as a matter of fact, and they did, in fact, establish some overflow facilities. And are using those overflow facilities in a little different way than what we had ever envisioned them in the past. And this again comes back to being supple and malleable to change. This has been like building an airplane in flight. There's some things that work, some things that don't work. Things that don't work, you put them aside and you start to figure out other ways that you can treat patients and stuff. So, in El Paso, one of the unique things that they did in terms of their quote-unquote overflow facilities was actually to use those facilities to treat patients with something like high-flow oxygen, something that can be effectively used outside of the formal hospital system. And if they can actually, get better on predominantly a supportive care with high-flow oxygen, then you're gonna keep that capacity open in your hospital that can be used for those that actually do fall into a more severe illness and stuff. So I'm pleased that El Paso appears to be plateauing out, although it be at a very, very high level, and are hopeful that we'll see these numbers start to come down. We're starting to see numbers also across the northern tier of cities, including Dallas, Fort Worth, Amarillo, Lubbock, Midland, Odessa, even over into Tyler. These are areas that to some extent may not have been impacted quite as bad when the southern sort of tier of cities was really running for everything and stuff. So, we've learned it through the process. We know what kinds of things are necessary to treat patients effectively. Some things worked very well. Some things didn't work quite as well. There was really no magic bullet that emerged through all of this effort, frankly, to date. We're all holding our breath on the vaccine. I think we're seeing that come to be a reality. And it's a place where I'm spending a significant amount of my time now in anticipation that with Pfizer and Moderna coming forward with their messenger RNA platform vaccine, that we are going to be able to, perhaps as early as Thanksgiving, start pushing vaccine out into the various positioning places in the state and start administering that vaccine. It will not even be close to the amount that's going to be required to do a mass vaccination. We would anticipate between Pfizer and Moderna, we would have about 1.5 million doses that we could administer to the first year of people that we would determine needed it and would benefit from it the most, as well as the community would benefit from it the most. And that would be, your frontline healthcare workers and stuff. Protect them so that they can take care of the critically ill patients and keep people, basically recovering and getting back into their communities and stuff. There's been a number of things that we've learned along the way. One of the things, as I mentioned in the high flow oxygen, is, we've tried to avoid the use of a ventilator. What we've found is that when you put a person on a ventilator, in light of some of the more terminal stages of the disease, that what we call barotrauma, the trauma of just pushing air into someone's lungs, can significantly worsen the condition. At some point, you may get yourself into a position where you can't do anything other than that, and it may be the only thing that can help the patient. But, we're trying to do as many things as we can do before patients get into that situation. And use of high flow oxygen is one of those things. The use of Decadron, which is a steroidal drug that's been around forever, that is very effective in treating people in the more terminal states of their conditions. There's, some things that we have learned are not as effective. One is something called convalescent plasma, one that we thought would probably be, significantly impactful and helpful. We're finding that there's really a mixed bag of evidence on that. Recently, the monoclonal antibodies from Eli Lilly and Regeneron. Eli Lilly's are out now. Regeneron's will surely be out shortly. These are manufactured antibodies that we hope would be the bridge from the time that we are in now until we actually had vaccine being administered. It does have its place, and it does appear to be effective. As most of you know, Regeneron is the product that the president got. He got a lot of other things with that. But there is at least some sense that there's a place for this, and if you give it early enough in the disease, not later in the disease, in fact, in the pre-hospital phase, these antibodies have some potential impact and can, in some cases, prevent a patient from ending up hospitalized. This is another area of research and things that have come out as a consequence of this crisis that really are groundbreaking. But as was mentioned earlier, the whole vaccine platform that we have gone through, whereas, getting a vaccine out within a year's time would be considered a pretty heroic effort. To see where we are right now from the time that the president established Operation Warp Speed, we are seeing, what is one of the most extraordinary transformations in the production of a vaccine that I think any of us have ever seen. I say this, and some people say, "Well, you must be losing your mind, Zerwas." But the truth be told, I've had a career in medicine for 35 plus years now, and I don't think there has been a more quote unquote exciting time to practice medicine and to see medicine practice, where so many things are coming together, technology, just the capabilities of our research engines, the whole pharma industry. It's amazing how when you push a lot of money and a lot of talent into a single disease, the kind of accomplishments that you can see. And the production of these vaccines in this incredibly short time frame with new platforms, new ways of imagining the production of vaccines is one of those things that have come out of this crisis that I think will have some lasting impact. What was also mentioned was the use of telemedicine. We've been doing telemedicine for quite some time, but it was always been sort of a plaything, frankly, as a physician. But now it became that thing that allowed us during that time that it wasn't safe to bring patients together, that we could actually reach out and touch them. And not only did the physicians find it a very, very effective and gratifying way to take care of patients, the patients likewise enjoyed it a great deal. Even some of your more elderly patients that tend to be a little bit technology averse. So great things have emerged out of this horrible crisis, I will say. Texas has remained resilient. They have been supple and malleable to change, I will say. My hat's off to all of our public health officials who have really stepped up day in and day out and dealt with this crisis. And my compliments to the governor for, he's the single guy in charge at this time in terms of a crisis. And I believe, he's managed it in a way that, clearly, is looking at what is in the interest of the public health in light of this pandemic. And so Adam, I know you're back on. I know that's my indicator that I need to wrap it up. And I will just say thank you all for having me. Thank you for what you're doing for San Antonio. What a great community it is. And I just wish you all the best as we go forward.
Well, Dr. Zerwas, I'm sorry, I didn't mean to rush you. I could listen to you all day. It's encouraging.
You're kind, but I know you wouldn't want to do that.
I'm particularly excited about the new vaccine platforms because they are apparently very safe. And we expect that this will allow us to adapt rather quickly to any type of a pathogen, any type of threat that really affects public health in a big way. So it's not only encouraging for ending the COVID pandemic, but I see there's great potential in this in the future.
It really is. And, the whole messenger RNA, platform to generate, an immune response is, frankly, that's all new cell biology to me in terms of using it for that purpose. But, thank goodness it looks to be very effective. And, at least early studies, indicate that it's going to be quite safe. And I'm hopeful that we can get that out sooner versus later.
Yes, may even stimulate some redesign or redevelopment of some of the classical immunizations that we provide. So there's a bright future ahead, I think, in the whole marketplace. And I think we have time for one question. And I'm sorry I have to ask this one, but it's the Texas legislature is preparing for its 87th legislative session. The budget is lean and recovery will likely be a priority, as you've indicated. How or where do you think the legislature may focus on healthcare and bioscience?
Well, nothing like a healthcare crisis to get people focused on a particular area. I do think that there will be a great deal of focus on the biosciences. Certainly there will be in the public health sector because there have been innumerable lessons learned from this. And we should step back and look at that and tell ourselves, why did we end up, shortchanged on PPE? Why did we end up shortchanged on reagents to run laboratory tests? Why were we chasing ourselves on all of these things, that are, so incredibly important to responding to a pandemic or disaster of any number of different kinds? We're pretty good at responding to the hurricanes because we get them year after year, and all the necessary things are put in place. And even then, you get a Hurricane Harvey and it's going to stress you out and stuff. But there are some things that I think that the legislature can look at from a policy point of view that will be very important to the future of Texas. And I'm certain that it won't only be Texas, it'll be the entire nation and the world, in fact, that'll be looking at some of these things. But, we should be better at stockpiling, the necessary PPE and ventilators and things of that, without letting them, deteriorate over a period of years. So a whole different thought process on stockpiling. We need to be better about, producing our own generic drugs. As I mentioned, Decadron, dexamethasone is a drug that's been around forever, but it's a very, very effective treatment for patients that are starting to go down the bad road of regarding their COVID experience and stuff. But there's drugs that you can only get them except overseas, and a lot of them in China, in fact, and so we've got to really step back and look at some of these things as to, what can we do to better position ourselves so that this doesn't happen again.
Well, thank you, Dr. Zerwas. We really appreciate your time today and the special insights that you bring. Very informative and also uplifting. So thank you again for being with us. And please come back and visit with us again soon at your convenience.
I will. Thank you, Adam, and congratulations.
Thank you.
Mazda talked about agile innovation, and I think that in addition to the resiliency, I think is another very, very good theme that really exemplifies what San Antonio is all about, agile innovation. Folks getting things done, focused on the needs of today and also the needs of tomorrow. And so I'm very, very gratified, of course, with the entirety of the healthcare and biosciences industry. $42 billion economic impact, 1 in 5 folks working in the industry, and an annual salary above the SA average. That's good news for all of us. And so I'm proud to say that San Antonio is on the move, and we are making a difference, and this industry is making a difference in this community. Remember that you can find the study on the Chamber's website on our landing page, www.sachamber.org. Scroll down a little bit, and you'll see the button for the Healthcare and Biosciences Impact Study. I want to thank again our speakers, our volunteers, our sponsors, and of course, you, our guests. We hope that you enjoyed the program. I want to reiterate what Belinda said at the beginning. We've got a couple of virtual events coming up, ending out the year strongly. We've got our inaugural nonprofit economic impact study. We've been approached by the not-for-profit sector for a couple of years now, asking us to put this study together to be able to show, just like we're showing with the healthcare and biosciences industry, the awesome economic impact that the not-for-profit sector has in this community. And it has been heightened by the effects of the pandemic. So please join us Wednesday, November the 9th at 2 p.m. Hear all about it. It really is going to be special, and we're excited to be able to share the results with you. And then our final event, our final major event of the year, is our One City celebration. It's a virtual annual gala, basically, where we're transitioning from our current chair, Adam Hamilton, to our incoming chair, Hope Andrade. It's going to be exciting. It's going to be fun. It's going to be during the day at 3:30. Generally, as you all know, we have this in the evening. It's a little different this year. We're going to have it Thursday, December the 10th at 3:30 p.m., and we're asking you to please join us as we transition this most important position for the San Antonio Chamber. Finally, I want to remind you all that the Chamber is a not-for-profit membership organization. For those of you who are members, thank you for your investment. Now more than ever, it's so necessary because the Chamber's work has not slowed down. In fact, it has only been heightened, just as I talked about the not-for-profit impact. Our work has gotten even busier because there's so much need and so much opportunity for us to help our business members through advocacy at all levels. And so please consider joining the Chamber as a member to help us do our important work. And before I close, I want to thank Belinda Garza-Hartwig also. She is leaving the Chamber for a great opportunity in Washington, D.C. She's been with the Chamber for about the last 4 years, and she's done great work. And Belinda, thank you for being a part of the team. You've been a great team member, and of course, we wish you well in your new opportunity as you move on to Washington, back to D.C., and do great things. With that, ladies and gentlemen, we say thank you. Be safe, be kind, be healthy. And from all of us here at the Chamber of Commerce, happy Thanksgiving. Take care. Bye-bye.